Next is Kevin Colbert from Houston Methodist Hospital. He will be presenting on reducing groin complications after vascular intervention.
Good morning. My name is Kevin Colbert. I'm a third-year medical student at Houston Methodist, and along with my mentor, Dr. Maham Rahimi, we are pleased to present our quality improvement process for the reduction in groin complications after vascular intervention. We have no disclosures. Vascular surgery involving the groin is noted to have a very high morbidity and mortality associated with increased hospital stay. An institutional quality improvement process at our institution determined that we had a complication rate of 43% with vascular procedures involving the groin. Leading causes of these were infection, seroma, and hematoma. It was noted by the department that we needed some additional strategies for mitigating these complications. So in our improvement process, we had two study goals. First is, can we identify high-risk patients based off of comorbidities and procedure types for additional surgical site management, as well as can we improve established surgical site management to reduce complications. So the way that this process worked is, first we identified this problem. The vascular surgery team at Houston Methodist noted that there was an increased rate of morbidity, mortality, length of hospital stay, readmission, and reoperation specifically for vascular surgery involving the groin. We then conducted a retrospective review from the years 2016 to 2019 at our own institution using EMR data and a team of IT analysts to help us extract all of the appropriate data, and found that we did in fact have a very high complication rate. We then interpreted this to kind of find out, what exactly was going on, what the underlying causes are, and divided it into 4 subsections, which was infection, seroma, hematoma, and other. And then we created a list of recommendations for all of the surgeons in the department, redesigned our entire perioperative protocol involving for any patient undergoing groin surgery, and then did these compliance checks where biannually, we would sit down with the entire vascular surgery department and listen to feedback on what is doable, what is not, how they like it, and how their patients are doing post-operatively. So for our improvement strategies, we did 2 things. The first is we created a model-based patient risk stratification. Basically what we did is, with that retrospective review data, we did a thorough literature review, gathered a bunch of odds ratios for comorbidities, and basically made a predictive model based off of and validated on our own institutional data from the years 2016 to 2019. We then implemented this model into a web and a phone application called VascuLink. You can see it at the bottom. This has been published. It's basically a phone and web app that you enter inpatient comorbidities, and it gives you a range of whether or not they're high or low risk and whether or not they may need additional perioperative management. We also updated our perioperative protocol. So we did a thorough literature review and found basically that there were some things that we could do to prevent these complications. As you can see, basically of note, we made sure that they had vancomycin and ceftriaxone preoperatively 1 hour before surgery, and postoperatively we gave them 24 hours of doxycycline, as well as basically just making sure that the surgical site is cleaned prior to operation. And then for those who were identified as high risk with our model, we had the opportunity to do additional surgical site management. This included using a muscle flap, using wound healing powders, and wound dressings such as negative pressure wound therapy or silver-coated dressings. At our institution, we then reevaluated the data after we implemented this perioperative strategy. From the years 2020 to 2021, we found that 132 patients at our institution underwent surgery involving the groin, and we had a decrease of 30% complication rates down to about 14.4% from 3 years prior. However, we found that some complication types, such as seroma, notably is the majority of that 14.4%, remain a challenge, and we could not find any predictive variables, and further studies are being done on whether or not we can find comorbidities that are predictive of seroma. In conclusion, we found that being very honest and critically analyzing our own complication rates opens up opportunities for improvement. and that we need to use multi-departmental and multidisciplinary teams often to solve these challenges. Strategies for continuous improvement with manageable endpoints is what we found really drove this process. We did these biannual compliance checks, made sure that everybody was on board, and could systematically reduce our complication rates. And for us, we found that this quality improvement process was successful because we implemented, these 4 different, what we call success factors. So the first is teamwork. We made sure it wasn't just, the vascular surgeons or the medical students or the vascular research fellows that were involved in this process, but it was really, a whole multidisciplinary effort. We also were very transparent about, what we were doing about our numbers and how we could improve them. We also made sure that everybody on the team was compliant with these recommendations. Sometimes, if we give recommendations, not everybody can follow them. Made sure that it was very doable. And then we also were responsive to, basically the team's criticism, and made sure to update our protocols appropriately. And then this is just kind of the team. We had a whole team of vascular surgeons, a team of vascular researchers, fellows, medical students, as well as an IT team as well. Thank you.